Acute encephalitis syndrome, or AES, is a major public health concern in Asia, primarily affecting children. In India, one of the major causes of acute encephalitis syndrome is the Japanese Encephalitis or JE virus. Approximately 2/3 of those who develop JE illness either lose one's life or suffer long-term neurological disabilities. Transmitted through Culex mosquitoes that breed in areas of standing water such as rice paddies, ponds and pig farming areas, the Japanese encephalitis makes rural communities of Asia particularly vulnerable. In 2005, a massive outbreak of JE occurred in the Indian states of Uttar Pradesh and Bihar. The Government of India intensified efforts and implemented a national strategy for JE control through immunization and subsequently with the establishment of encephalitis treatment centers in some of the high endemic states. Over the next 10 years, the government successfully implemented an effective JE vaccination program using live attenuated SA14-14-2 vaccine and later integrated into routine immunization programs. Bihar, the third most populous state in the country, suffered frequent JE outbreaks. In 2005, around 200 cases were reported with a huge number of deaths.
JE एक बहुत ही खतरनाक बीमारी है, विशेष तौर से बच्चों के लिए। इससे निजात पाने के लिए भारत सरकार की मदद से बिहार सरकार ने बहुत मेहनत की है। JE प्रभावित जिलों में 16 साल से कम तक के सभी बच्चों को मिशन मोड में JE के विरुद्ध इम्यूनाइज करना और एक बार इम्यूनाइजेशन कंप्लीट हो जाए तो फिर इसे रूटीन इम्यूनाइजेशन का हिस्सा बना लेना, यह सरकार की स्ट्रेटजी रही है।
हम लोग लगातार प्रयास करते रहते हैं, नुक्कड़ नाटक करवाते हैं, फिर अखबारों में देते हैं, फिर समाज के अलग अलग विकास मित्र हैं, PRI मेंबर्स हैं जैसे मुखिया, सरपंच, वार्ड मेंबर, सबका सहयोग लेके एक मैसेजिंग करते हैं हम लोग कि ताकि ये बताया जा सके कि कितना सुरक्षित है और बच्चों के सुरक्षा के लिए कितनी आवश्यक है।
In 2007, the Government of Bihar, supported by the Bill and Melinda Gates Foundation and technical assistance from PATH and other partners, initiated a large-scale JE vaccination campaign targeting children from 1 to 15 years of age in selected high-risk districts in a phased manner.
The Gates Foundation invests heavily in routine improvement of health service delivery. It was that right opportunity to support a very wide age cohort campaign. We can leverage the campaign to improve visibility regarding disease prevention as well as the importance of routine health programming.
Across the country, PATH has been supporting in high quality and safe vaccination campaigns. The components of micro-planning, training, developing guidelines, monitoring, data management and ensuring that we have maximum coverage with safety.
In Bihar, the campaign was introduced with the following objectives.
Initially, we faced a challenge because we have to train the medical officers, we have to train the paramedical workers. It has to be kept in the cold chain. It have to transport it in the cold chain. So all these logistic arrangements that with PATH support and successfully completed the JE vaccination campaign.
In the first phase through 2007 to 2012, 8 historically JE affected districts of Bihar were targeted. A total of 7.47 million children were vaccinated from all 8 districts. In the second phase from 2013 to 2015, the campaign was scaled up to 24 of Bihar's 38 districts. During 2015 to 2017, the government's JE vaccination continued through routine immunization. During this time, the Government of Bihar, with support from PATH and BMGF, advanced AES surveillance measures and strengthened health facilities to function as encephalitis treatment centers or ETCs.
बहुत सारी संस्थाएं हैं, बिहार स्वास्थ्य समिति हो गए, यूनिसेफ हो गए, पाथ हो गए, जो हम लोग को समय समय से ट्रेनिंग देते हैं और उससे हमको बहुत फ़ायदा भी होता है।
The government ensured that there is well-equipped infrastructure, vaccination is provided on time, health staff is trained, IEC material is distributed for awareness and prompt treatment is given to patients in ETCs.
उन लोगों के लिए हमने जगह जगह जो IEC मटेरियल लगवाए ताकि लोग पढ़कर चमकी बुखार के बारे में जान सकें और समुचित जगह पर वो सही समय पर तुरंत पहुंच सकें।
Many children recovered, including Sati, who was infected with JE, but is now living a healthy life.
शरीर में बीमारी बढ़ते जाते हैं का, अब बढ़ने के बाद फिर वही गए हैं पटना, अब पटना ले जाने के बाद ऑक्सीजन लगला, ऑक्सीजन होला के बाद फिर वही सुधा हुआ है।
In 2019, with a fresh outbreak of JE in multiple new districts of Bihar, JE vaccination campaign was undertaken using vaccines manufactured domestically under the Prime Minister's Make in India initiatives. Health workers on the ground, such as ASHA and ANM, played a crucial role in raising awareness among people in some of the most remote areas of Bihar.
एक दिन पहले ही घूमकर हम लोग ड्यू लिस्ट बनाते हैं, उसमें कितना गर्भवती है, कितना नया बच्चा है, कितना माने पहले से बच्चा का सुई पड़ा है, उन लोग के घर घर जाके कि दीदी कल वैक्सीन पड़ेगा, आप वहाँ पे आ जाइएगा।
आशा भी आए थे मेरे घर पे कि टीकाकरण का सुई दिलवाना है चमकी बुखार का, इसलिए अस्पताल में हम अपना बच्चा को सुई दिलवाने के लिए आ गए।
शिक्षा विभाग के शिक्षकों से, पोषण से जुड़े लोगों से, जन वितरण प्रणाली के कार्यकर्ताओं से सबों का सहयोग मिला हमें जागरूकता फैलाने में और बीमार बच्चों को शीघ्र तुरंत अस्पताल लाने में।
The progress made over the years was threatened by the novel coronavirus in 2020 that put immense strain on the healthcare workforce. But amidst the challenging backdrop of the COVID-19 pandemic, the JE campaign in Bihar during the final phase displayed unwavering determination, persisting and advancing in strategic phases. Catch-up campaigns were held in the high-endemic districts of Bihar in a phased manner to vaccinate those children who missed any of the 2 doses of the JE vaccine in routine immunization due to COVID-19. Through vigorous community outreach and social mobilization programs, the campaign penetrated even last-mile areas of Bihar. JE was one of the major hurdles to the continuation of education for children. But with the continuous efforts of the government, students were able to resume their studies and achieve their dreams.
जब बच्चे स्कूल में आने लगे, जब उनका भय समाप्त हो गया, तो बच्चों में शिक्षा के प्रति वो पुरानी वाली जागरूकता आ गई।
From 2007 to 2022, more than 38 million children were vaccinated in JE campaigns across 38 districts of Bihar.
हर साल कुछ न कुछ केस रहते थे, 2022 में कोई भी केस नहीं मिला, तो जाहिर है कि वैक्सीनेशन कवरेज और JE के रोकथाम, प्रिवेंशन और ट्रीटमेंट में पाथ ने बहुत ही सपोर्टिव रोल प्ले किया है।
बिहार सरकार ने, बिहार राज्य ने, सब लोग मिल करके, हम लोग मिल करके चमकी बुखार को भगाए हैं और हराए हैं।
इस कैंपेन के लिए विशेष तौर से पाथ को मैं शुक्रिया कहूँगा, जिनके सहयोग से पिछले 1 दशक में JE पर काफ़ी हद तक काबू पाया जा सका है।
All the learnings that we have from the Japanese Encephalitis vaccination campaign is critical for us for any other program. We will have to ensure that there is a good micro-planning, that we have a good mapping, that we measure it well, we have a good mobilization of the community, and we have adequate manpower.
It's been a very, very fulfilling engagement, and I think the support from the government and the understanding and partnership has really helped us move forward in this cause.
The full immunization coverage in Bihar has increased from 11% in 1999 to 93% in 2023. As part of these efforts, the government has focused on equity of access, working to ensure that everyone can receive life-saving vaccines. The JE vaccination program is delivering a brighter future for the children in Bihar and helping India reduce its JE and AES burden significantly.